Hi, so this is Charlotte Pedley providing just a bit of a short screencast for the therapeutic management of neuromusculoskeletal pain module. And this is a module that I module lead on and one of your potential options going forwards on your course. So I just thought I'd introduce you to the module itself. So the aim of the module is so that you can gain a broad understanding of the dimensions of pain, thinking about the critical awareness of the current strategies for managing pain non-pharmacologically, and thinking about an ability to apply pain management principles effectively within practice, and thinking about your current practice. So the learning outcomes of the module is to think about explaining relevant pain processes related to a clinical scenario. So we'll get you to think about a case study or something that you've come across within your practice that might be relevant to a pain scenario, and think about what pain processes might be having an impact on that patient or that case study that you're bringing to the forefront. And then we'll ask you to have a look at justifying appropriate management strategies that might be appropriate for the clinical scenario. And that may be management strategies that you have utilised previously, or you might reflect on that case study and think that there might have been a more appropriate management strategy based on the information that we do give to you over the course of the module. And then we'll get you to critically reflect on the significance and impact of interpersonal communication and education in the management of pain processes. So how do we as therapists have an impact and make a difference to somebody who is experiencing pain and is struggling with either an acute issue or a chronic issue? And what does the literature say about that, and what can we glean from that information, really? The learning and teaching for this module will have some elements of webinars, so there'll be virtual spaces where you can engage with tutors using video and conversation platforms, and we might use things like Zoom or Microsoft Teams just to add to that, to make it a little bit easier for you to engage with your peers and also with ourselves. We might use things like discussion boards, which are monitored by staff, so you can answer any questions that you might have throughout the module. And also there will be tutor directed learning, so that we might have theoretical materials, and we might have screencasts that we use to support your learning throughout the module itself. The timetable looks similar to as above, really. So the first week would be introduction to the different concepts of pain. Then we look at input mechanisms. And then the following week we would look at central processing and outcome mechanisms. And as you can see, there's formative assessment and summative assessment within there. So we feed in some of the assessment guidelines throughout the module, and give you opportunity to be able to practice some of your assessment by utilising that formative assessment opportunity. And then the fourth session is, so what are you going to do about it? So what are we going to do about pain as a therapist? And we have lots of feedback from this module that it's really useful within general everyday practice, and that people really enjoy the module. The module itself is there's a lot of information to get into the module. There is it can be quite a tricky module, and some people do struggle with the the depth of the information that we go into. There will be a lot of background reading required to be able to bring you up to speed with the information that is out there around pain processes. So I think all in all, the module is enjoyed, but I think people do struggle with the concepts sometimes of pain and how much information and depth they need to go into. In relation to the assessment side of things, the assessment is done as a screencast. So you would present your case study as a screencast for the assessor. And then there is a Viva afterwards, whereby we would ask you some questions to deepen your knowledge around pain and just get some more information from you about your understanding of pain processing, and also the impact that we as therapists can have on that specific case study. So there's multiple opportunities for you to practice, and there's multiple opportunities for you to feed this information within your general everyday practice. So that's the therapeutic management of neuromusculoskeletal pain in a nutshell. I hope that's been helpful for you, and I look forward to seeing you on the module.